It's the summer of 2010. I'm in Hong Kong in a taxi with my family, and we're going to our first family gathering of the trip. And I was born and raised in the Bay Area, so English is actually my native tongue. And so knowing that my aunts and uncles were going to ask me about what I was studying in school and working on, I was asking my mom to translate all of these words into Cantonese. So I'm asking her to translate what's undergraduate in Cantonese, and she tells me it's complicated. I ask her what UC Berkeley is, and she's like, just say it in English. And then I ask about psychology, like psychology or mental health, how do you say that? She looks like a little puzzled, which isn't totally out of the norm, so she takes out her phone and she starts scribbling into a translation app. And after a minute, she kind of bobs her head back and forth and says, I'll just tell them you help make people happy. In that moment, I realized that, I remember that mental health wasn't something we talked about in our family. If you were good, you were good, and if you weren't, you spent time with family, spent less screen time, got your good grades, and you were fine. Several years later, it's 2018, I'm at a friend's happy hour at a different company. It was probably for Mardi Gras, or the many reasons we have happy hours at companies now. And me being a super strong introvert, and my friend had gone to the bathroom, I'm totally thriving with all these new people, and making small talk. And perfectly naturally, they ask me what I do for work, and I say workplace mental health. I work at Mindshare Partners. And they ask me, oh, that must be really tough. How did you get into mental health? And I pause and I think about how I've managed chronic depression my entire life. I think about whether this is the time and place. It's like Mardi Gras, and I'm like, I have chronic depression. And kind of feeling awkward and not really knowing what their culture was around workplace mental health. Very open at Mindshare Partners, but this was a new environment. And so I hesitate, and in that moment I say, always been interested, something I'm passionate about, really lucky to work on it. What do you do for work? And I realized that that was a moment to be a leader, but I didn't take that chance. Now 2019, a few months ago, I had my first daughter. By daughter, I mean my cat. And even though I grew up with pets, I didn't realize this phenomenon that happens, confirmed by Google, called post-adoption depression, where kind of like having a kid, you suddenly realize the responsibility that you have. And I know it's just a cat, but it's basically a child. And I remember sitting in a Monday meeting, and Jen, Kelly, and I are checking in, and they're talking about their weekends, and they ask me how I am. And I tell them I'm like really anxious. I've been super out of it all day thinking about my cat back home. I have a neighbor that's very sensitive to noise in my apartment, and just looking forward to the next several years. And I remember starting to explain, and I remember before even kind of finishing my sentence, they said, it's totally fine, do what you need to do, and let us know if you need any help. So today we're going to talk about culture a lot, and all of the elements that enable or hinder or complicate that process. In my first story, there's this element of diversity and how different communities engage with and understand and talk about mental health. I'm an Asian gay male, and in many Asian households, you don't talk about mental health. As a man, you're not socialized to really be emotionally expressive. That's changing nowadays. And being in the closet does wonders for your mental health over the years. In my second story, there's this element of ambiguity and social norms, and we found that sometimes stigma is a barrier, and sometimes just finding the right time and place. I didn't want to be a downer. I didn't really want to get deep into it at the time, even though that was kind of my authentic reason. And lastly, there's this kind of element or the goal of having this open and supportive culture. And today we'll talk about all the different ways you can create this culture, like leaders going first and the RGs and programs and policies. There's also these very simple day-to-day interactions that really highlight that a simple human response can do a lot for a very human problem. Thank you.